Hi, thank you for choosing Henry Meds for the treatment of erectile dysfunction, or ED. This is a common condition that affects many men at some point in their life. The most common treatments for ED include pills, injections, a vacuum device, and the penile implant procedure. In this video, we'll explore penile injections as an option for patients that have not had success with other treatments, or for men who are unable to take ED oral medications. Injectable medication is generally not covered by insurance. Injectable medications, commonly referred to as Trimex, Bimex, or Quadmix, that are prescribed by Henry Med's healthcare providers are specially formulated by a compounding pharmacy for maximum efficacy. Compounded medications are not FDA approved, and you should consult with a healthcare provider before use. With this information in mind, let's move on to the demonstration of how to perform a penile injection for erectile dysfunction. First, be sure you have your medication, supplies, and any emergency or rescue medications in front of you on a clean surface. Here you'll see we have one syringe, two alcohol wipes, the medication vial, a sharps container to dispose of syringes after use. We also have rescue medications. Phenylephrine 0.1% was included with your medication from Henry Meds. Have a second syringe available and extra alcohol wipes if phenylephrine is your safety medication. This medication comes in a glass vial and often requires storage in the refrigerator or freezer. Be sure to store your medication according to your instructions provided by your pharmacy. After removing the vial from the refrigerator or freezer as instructed by your provider, then inspect the medication vial. Do not use medication if the fluid inside is cloudy, has particles floating in it, or if the rubber stopper comes off. For this demonstration, I'm using a 30-unit syringe with a 5/16-inch needle. Note, your doctor may choose a different syringe or needle based on your personal needs. Start by thoroughly washing your hands with soap. Then remove the seal from the medication vial. Now, remove the cap from the syringe without letting the needle touch anything. If the needle comes in contact with another object, dispose of it in your sharps container and get a new syringe. Pull the plunger on the empty syringe of the dose instructed by your provider. Take note that doses will vary from patient to patient. Be sure to use the dose prescribed for you by your healthcare provider. Pulling the plunger will draw air into the syringe. Now, insert the needle into the rubber stopper and push the plunger to insert the air from the syringe into the vial. This makes it easier to properly fill the syringe with medication. Turn the vial upside down with the needle still inserted and pull back the plunger, filling the syringe to the prescribed dose. Keep the tip of the needle under the fluid level in the vial to draw the medication. If you see air bubbles in the syringe, draw extra medication from the vial, allowing the air bubbles to float to the top of the syringe and then slowly push the air bubbles out of the syringe. Look at the numbers on the side of the syringe to be sure that you have the correct dose. Also, check to ensure that there are minimal to no air bubbles. Remove the needle from the rubber stopper and loosely replace the cap on the syringe. Set the syringe down on a clean surface. Immediately return the medication vial to its appropriate storage location. As you prepare for injections, keep this information in mind. Penile injections are most successful when delivered while standing, if you are able to stand. The injection should be given along the side of the shaft, about halfway between the base and the head of the penis. Do not insert the injection into the head of the penis. The injection site should be at either the 10 o'clock position on the left side or the 2 o'clock position on the right side of the penis shaft. Each time you give yourself an injection, alternate between the left side and the right side. Do not inject straight down on the top side of the shaft, where the nerves are, or directly at the bottom of the shaft, where the urethra is. Avoid injecting directly into a large vein, as this may cause a bruise or bleeding. Let's put the injection process into practice. Locate the correct area of the penis for the injection. Clean the injection site with an alcohol wipe. Let the area dry. Then pick up the syringe and take the cap off. Check one more time to make sure the medication dose is correct. If more medication is needed, draw more from the vial using the same steps as before. Hold the syringe between your thumb, index, and middle fingers, like you would hold a pencil. Have the needle pointing down. If you aren't circumcised, pull your foreskin back before grasping the head of your penis. Stretch out your penis by grasping the head straight out in front of you, or to the side opposite where you plan to inject. Hold your penis with 2 fingers in your hand positioned against the scrotum. You can also extend the penis against your thigh for greater stability. Keep pulling on your penis from the time the needle goes into the shaft until it comes out. Do not twist or rotate your penis to avoid accidentally injecting the top or bottom surfaces. Quickly slide the needle into the shaft of your penis. Ensure the needle is fully inserted into your penis to ensure the medication is delivered to the correct location in the penis. A superficial injection into the skin will not produce the desired effect. Move your thumb to the plunger and push down to inject the medication. Be sure to keep the needle in place. After injecting all the medication, quickly pull the needle straight out. With an alcohol pad, apply pressure on the injection site for 2 to 3 minutes. If you take a blood thinner such as aspirin, Plavix, or Brilinta, apply pressure for 5 minutes to decrease any potential for bleeding or bruising. Carefully dispose of the syringe into your sharps container. You don't need to recap it. Wait 5 to 10 minutes after the injection for the medication to take effect. To keep blood flowing downward, you may sit, stand, walk around, or start foreplay. Do not lie on your back. The goal is to achieve an erection sufficient for intercourse lasting no longer than 1 hour. Response may vary by individual. You can inject the medication up to 3 times a week, but no more than once every 24 hours. Keep a journal to help your healthcare providers adjust the dosages as needed. Entries should include dose injected, hardness, and any duration of erection. Any symptoms associated with the current dose, such as burning, pain, or bruising. Be aware of these warnings related to penile injections. 24 hours before or after the penile injection therapy, do not take any of the following medications: sildenafil, known as brand name Viagra; vardenafil, known as Levitra; avanafil, known as Stendra; tadalafil, known as Cialis. If the medication doesn't work, don't give yourself another injection for at least 24 hours. Do not go to sleep until your erection is bendable. If your erections are lasting longer than 1 hour, consider reducing your dose by 2 to 5 units. Do not use the penile injections unless you have rescue medication nearby. If you experience an erection that is hard and not bendable, lasting longer than 2 hours, inject 10 units of phenylephrine into the middle third of the penile shaft, between the base and the mid portion of the penis. Inject over 4 seconds. Repeat the same dose of phenylephrine injection every 3 to 5 minutes as needed until resolution. Do not give yourself more than 3 injections of phenylephrine. If erection is not bendable after 3 injections, or your erection lasts a total of 3 hours, seek care at the nearest emergency room immediately. Occasionally, penile injections can cause fainting, dizziness, and low blood pressure. In rare instances, priapism, or prolonged erections can occur. Patients who are not trained properly may experience pain, infection, bruising, and scarring. If your erection remains rigid for more than 3 total hours, seek immediate medical attention at the nearest emergency room. Delaying care beyond 4 hours may result in permanent damage. Erections remaining hard for more than 4 hours may result in permanent and irreversible damage to the penis and worsen erectile dysfunction. If the medication is not giving you a rigid enough erection for penetrative sex, first be sure that you are using the correct technique to inject the medication. If you are, then try increasing your dose by 5 units the next time. For example, if you started with 15 units, wait at least 24 hours, then try 20 units. Continue to increase the dose by 5 units each attempt until you achieve the desired firmness. Do not exceed 50 units in a single injection. If you continue to experience a poor response, your medication concentration may be adjusted under the guidance of your provider. Injection therapy is not for everyone. Some men may be unsatisfied with the treatment due to pain or ineffectiveness, or they might not like needles. Several other options exist, including the penile implant procedure, which is an alternative to injection therapy and is covered by most insurance plans. If you're not satisfied with your injection treatment and want to discuss other options, or if you've not yet started on a treatment for ED and you want to learn more, make an appointment with a Henry Meds healthcare provider. We're here to help.